Hello. There is another interesting question asked by one of the doctor in my Facebook group. So the question is, a patient is 67 years, had pneumonia 3 months ago, and history of sleep apnea with CPAP and pacemaker for bradycardia. X-ray chest given for her pneumonia 3 months ago and with another X-ray today. He wants to travel interstate and need advice about pneumonia. Take history, explain chest X-ray to him. Explain pneumonia risk assessment after 7 minutes. Please discuss this case. Okay. So I personally think this is a very straightforward case. Sometimes, the cases will be very easy to the extent where doctors will think there is a trap or there is something there that will fail you. So all you need to do in this case is, just take history, like any pneumonia case or any patient with a cough case, and explain the look at the x-rays first and see if there is any change there, because you need to see if he was treated for pneumonia. You need to see, is it getting better, worse, or just the same. You need to take a bit of cardiac history as well, and a bit of history about sleep apnea, how his sleep is, whether there are any other symptoms related to heart disease, because he has a pacemaker for bradycardia. Apart from that, I don't think there is anything we need to be worried in this scenario. It's a instead of a 67-year-old male has come to you with cough, they just changed it. And probably when they add few things like having a pacemaker, x-ray 3 months ago, x-ray today, that's only trying to trick you guys. So I don't think there is any trick or trap in this scenario. He wants to travel interstate. Okay, so when he's traveling, you need to look at few things there, because he's 67. You need to look about things like pulmonary embolism, so that is one thing I would be interested in this case. I will ask how he is traveling, like, is he going by road, or is he going by flight, or is he going by train? And you need to talk about the DVT prophylaxis there, because it's very important. If this patient is actually sitting for prolonged periods, he's at high risk of getting a clot in the legs, like deep vein thrombosis. So you need to probably give a bit of advice about it. Pneumonia risk assessment after 7 minutes. So obviously you need to ask about history of cough, shortness of breath, whether he has got any vaccines. A person of this age group will need vaccines to avoid getting pneumonia. Whether he was hospitalized in the past year, whether he is on home oxygen, minor things like this. But apart from that, I don't think there is anything serious. It's a straightforward scenario. Sometimes they trick you by giving things like, oh, he had pneumonia 3 months ago, he came now, he had another x-ray. See, I never came across this scenario. Just based on what is given on the screen there, I'm guessing what the scenario might be, but the actual scenario might be slightly different. But what I'm telling is based on what I can see on the screen. So I hope this will be very helpful. See, sometimes these cases will be easy. You will actually fail yourself by complicating the scenario. So just think carefully, why is he traveling interstate? What advice should I give him when someone is traveling interstate? Why did they say that he is going interstate? Apart from that DVT advice, probably I don't think there is anything serious. And the second thing would be vaccinations in this patient. Third thing may be a bit of cardiac history. Apart from that, I don't think there is anything important or significant. It might be one of the easiest cases in your exam. So, don't think too much. Sometimes easy cases are also there in the exam. If you think too much, you will complicate the scenario, take unnecessary history, and fail the exam. I hope this helped you. And if you have not yet joined the group, make sure you join the group. Go to Facebook and type 2015 AMC Clinical Study Group, and that's where I'll be posting my videos. And if you have any doubts, feel free to post it in the group. Whenever I have some time, I will do a video. Sometimes I might be busy, I might not do a video, but I'll try to do it as soon as possible, and make sure you invite your friends, to the group so that they will also be benefited. Yeah, that's it. Good night. See you later.